Dr. Kohli is here, and I can't believe it. It's March 1st. Unbelievable. Before we get to the pandemic, we're approaching 2 years. I really want to get your point of view, Dr. Kohli, on the war in Ukraine and the mental health, how it's not only hurting, obviously, the people there, but even people from afar who are very invested in watching it.
It's so true, Sam. I mean, war anywhere affects people everywhere. And I like to think about it like a stone being thrown into a pond. It creates ripples. So obviously the biggest ripple is going to be the one right where the impact of the stone was, but it's really all across the miles that it's impacting us. And I personally have experienced just an increase in my own anxiety, just watching what's happening on TV. But we know that anxiety, depression, PTSD, and substance use are all longer-term consequences. But I have to be honest, the ones I worry about the most are kids. Because when you watch television, the media amplifies and concentrates the trauma. It shows us those people waiting at the border, shows us that 40-mile-long convoy, and our kids watch that, and there's data that it could affect our kids in the long term.
So where are we right now, getting back to the pandemic, Dr. Kohli? Because I can't agree with you more about the ripple effect, because everyone in the whole world's affected by what's going on in Ukraine. Let's get back to COVID a little bit, also affecting the whole world. Where are we with the pandemic right now?
You know, we're actually in a pretty good place. So you know how when you're in a relationship, you start with the honeymoon period, and then you start fighting?
Yes.
With COVID, it was the opposite. We started with the fighting, and now we've gotten into a honeymoon period with this virus. So I actually feel like now's the time where most of us are immune, the infection rates are low, and so now really is the time to start to relax a little bit. But keep in mind that what you do today will affect what happens tomorrow.
So COVID's not gone?
COVID is definitely not gone. In fact, something worse could be looming on the horizon. So don't abuse this honeymoon period. Don't be bad to each other, because what's going to happen next is the fighting's going to come back.
Okay, so let's talk about the part of the honeymoon where the protection is removed, because all over, seriously, all over the country, more states are announcing that these mask mandates are going away. A number of states have ended it, and now also for school. So it's now really the time to be unprotected.
Yeah. So when the protection comes off is so important to the relationship, right? It's so important to it that day, but also to where it goes in the future. And if you take it off too early, you're going to regret it later, right? You're going to wish you hadn't taken it off. So I think what we do today with our masks is going to decide our tomorrow. So there's really two sides to this coin. One group of experts saying, now is the honeymoon period. If we're ever going to take a break from the masks, now is the time. Another group of experts, the ones that I sort of tend to side with, is that our kids are not yet vaccinated, under 5. The 5 to 11, we're learning the vaccine's not working very well. And what we do today could predict a variant tomorrow. So for schools, Erica, I have to say I wish they had left it on a little bit longer, just until we get an Omicron-specific vaccine into our kids.
You advised my child, Sophie, who's obviously not vaccinated, she's underage, to still wear her mask. She's like the only one wearing her mask at school, but it's totally okay. Like, because I talked to her about it. I was like, is this okay with you? You know, you have a little brother at home, doesn't have an immune system. She said, yeah, I'm okay to wear it. If she's not okay to wear it, I do want to respect that. Is now the time to allow her to not wear the mask, or no?
Yes, I think every parent, every child has to have that individual decision making, because really the responsibility, guys, has shifted from the government telling us what to do to us assessing our family's risks, seeing who else is at home, seeing what our individual situations are, and then making a plan with our kids. So very important to engage the kids, because you don't want Sophie to feel different because she's wearing the mask.
Right.
But at the same time, she might feel more confident or more protected. I know my nephew does.
So does she.
Loves to wear it.
She does too.
Yeah.
Weird. Really quickly, I want to ask you the Pfizer vaccine. I mean, we've always advocated for it for children. 12% effective. Do we reevaluate now?
Yeah, this was a little bit of a bummer. So preprint study that came out, so we haven't confirmed it now with other studies, and it's not been peer reviewed, but what it showed is that 1 month after kids 5 to 11 are given the vaccine, the effectiveness goes down for protecting from infection from 68 down to 12. And in terms of protecting against hospitalizations, from 100% down to only 48%. So
Doc, full disclosure, this is something we've been talking about, and I've been avoiding you. Because you would get after me about it, because I'm like, I'm not sure. Just full disclosure, my kid's 5 years old. He just turned 5, so I'm right on the board of should I or shouldn't I? And now we get this information.
You're leaning towards not doing it.
I mean, What would you suggest?
So it still protects him against severe hospitalization to 48% versus nothing at all. And I think the dose is the problem here. So I think down the line, we're going to either come up with an Omicron-specific vaccine, which will obviously offer more protection, or we're going to use a slightly different dose in this age group, because we're seeing the kids over 12 that got the higher dose, they're doing a little bit better in terms of protection. But there's still something. So Jeff, if you have nothing versus something, I would still lean for something, because the chance of him having an adverse reaction or any problems we've seen is very, very small. But again, at this point, it's starting to shift into individual responsibility. So you have to think about your other kid who's at home, who's, you know, probably
Who's three?
How old is he?
Layton's three, yes.
Yeah. So he's got some immune system, but he's not nearly as protected in terms of his overall immune system.
But isn't the percentage for fatality, and again, I'm getting into statistics I'm not exactly sure of, but isn't it like 0.000 something if they do not have any predisposed condition?
Yes, but we're seeing kids end up in the hospital more than ever. And we're seeing that because there's just so much Omicron around. So the absolute number of kids getting sick is higher. So more of them, even if it's a small percentage, are ending up in the hospital. And we don't yet know the long-term effects on your sons. We don't know the effects on fertility or on growth. It's like the chicken pox, right? I wish I had never had it, but it's inside me now forever, and it could reactivate and become shingles. We learned that EBV causes multiple sclerosis. We just learned that a couple weeks ago. That's
EBV?
the kissing
Sorry.
disease.
What
The kissing disease, mono.
Oh,
Remember, everyone in
EBV?
college had it. Yes.
Oh.
Yes. And so,
I didn't know that was still around, the kissing disease. I remember it in
You
high
haven't been
school.
around.
These lips, I've only been kissing one person. I'm talking that way, okay. I'm embarrassed.
But thank you, Doc, yes.
Thank you, Dr. Kohli. We appreciate you as always.